This ear drop is used to treat outer ear infections caused by bacteria, also known as swimmer's ear. It contains neomycin and polymyxin, which are antibiotics that work by stopping the growth of bacteria. It also contains hydrocortisone, which is an anti-inflammatory corticosteroid that works by reducing ear swelling and discomfort. This medication treats only bacterial ear infections and will not work for other types of ear infections. It's important to use it only as directed, as unnecessary use or overuse of any antibiotic can lead to its decreased effectiveness. Be sure to follow your doctor's instructions for the proper dosage and the best time to take it. Administer this medication in the infected ear as instructed by your doctor, typically 3 or 4 times a day. Ensure that the ear canal is clean and dry before applying the medication. Only use it in the ear, and avoid using it in the eyes. To ensure the correct amount of medication is given and to prevent touching the ear with the dropper, have someone else administer the drops if possible. Hold the container in your hand for a few minutes to warm it and reduce the risk of dizziness. Before applying the ear drops, wash your hands. To prevent contamination, avoid touching the dropper tip or letting it touch your ear or any other surface. Lie on your side with the affected ear facing upward. Hold the dropper directly over the ear and place the prescribed number of drops into the ear canal. For adults, help the drops roll into the ear by holding the earlobe up and back. For children, hold the earlobe down and back. Keep the head tilted with the treated ear upward for 5 minutes, or insert a soft cotton plug if directed. Another method of administering this medication is to place a cotton wick in the ear canal and moisten it with the prescribed number of drops as often as directed. The wick should be replaced at least once a day. Repeat the above steps for the other ear if instructed to do so. Do not rinse the dropper, and replace the cap after use. Use this medication regularly to receive the most benefit from it. To help you remember, use it at the same times each day. Continue using this medication for the full time prescribed, even if symptoms improve after a few days. Stopping the medication too early may result in a return of the infection. Do not use this medication more frequently than prescribed or continue using it for longer than 10 days. Inform your doctor if your condition persists or worsens. When using Neomycin-Polymyxin-Hydrocort solution, non-dash, you may experience a temporary stinging or burning sensation in your ear for a minute or 2. If these effects persist or worsen, notify your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, you should contact your doctor right away if you notice any hearing problems, such as hearing loss. Prolonged or repeated use of this medication may lead to a new fungal ear infection, so it's crucial not to use it for longer than prescribed. If you notice new or worsening symptoms, be sure to contact your doctor. While a severe allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching, swelling of the face, tongue, or throat, redness of the ears, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using Neomycin-Polymyxin-Hydrocort solution, non-dash, make sure to inform your doctor or pharmacist if you have any allergies to neomycin, polymyxin, hydrocortisone, aminoglycoside antibiotics, or corticosteroids. This solution may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, let your doctor or pharmacist know about your medical history, especially if you have any other ear problems, or if you have an ear infection caused by a virus. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding. Now, let's talk about the daily dosage and the best time to take this medication. When taking Neomycin-Polymyxin-Hydrocort solution, non-dash, it's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's essential to get their approval before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Neomycin-Polymyxin-Hydrocort solution, non-dash. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help. In the United States, you can reach out to your local poison control center at 1-800-222-1222. If you're in Canada, contact your provincial poison control center. Remember, this medication can be harmful if ingested. Remember, it's important not to share this medication with anyone else. This medication has been specifically prescribed for your current condition, so it's essential not to use it for any other infection unless your doctor instructs you to do so. In addition, it's crucial to keep the infected ears clean and dry. Try to avoid getting the infected ears wet when bathing, and refrain from swimming unless your doctor advises otherwise. This will help ensure that the medication can work effectively to treat the infection. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one and take the next dose at the usual time. Don't take double the dose to make up for the missed one. When storing Neomycin-Polymyxin-Hydrocort solution, non-dash, make sure to keep it at room temperature away from light and moisture. It's important to keep all medications out of reach of children and pets to avoid any accidents. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.